President Trump is making headlines this morning after linking autism to Tylenol. He says taking acetaminophen, the active ingredient in Tylenol during pregnancy, could raise the risk of developmental disorders in newborns. That's despite medical experts saying the medication is safe to take while pregnant. Joining us to talk about this morning is Dr. Adam Weinstein. He is a professor of medical sciences at Quinnipiac University. Doctor, good to have you here this morning as we work to make sense of all this. What does the current medical consensus say about Tylenol and autism?
Yeah, thanks so much for having me. They're recognizing there's a lot of concern about this question and autism in general, and there have been a lot of studies evaluating this association, but none of them have yet proven a cause and effect relationship between the two. And so currently, the medical consensus is there's not a proven cause or effect to show there's a causative relationship that acetaminophen use in pregnancy causes autism.
There was this BMC environmental health study that looked at 46 studies back over the summer. 6 of them established an association, as you mentioned, but they stopped short at saying causation. Do you think this is what the administration is pointing to, or perhaps is there more data that they have not released yet?
Yeah, I believe that study is something that caught the eye of the administration. It's important to, as you noted, that not all of them actually even found an association, and that not all, and they certainly didn't point to a cause and effect. The study authors actually stated it's important to evaluate this further to see if there could be a cause and effect relationship, but that hasn't been proven. And there's actually been another study that studied siblings, and one sibling had exposure prenatally and the other one didn't. And that sort of study is able to explore that question a little bit more in depth, and that actually refuted the cause and effect. So that the results of that study actually suggest there is not a cause and effect relationship.
The CDC says as of 2022, 1 in 31 kids were diagnosed with autism compared to 1 in 68 in 2015 and then 1 in 2000 and 1980. What's the explanation for that jump?
I think it's more awareness of the diagnosis and other neurological conditions. It's also better diagnostic criteria for the diagnosis. So physicians are able to now make the diagnosis in individuals who have milder symptoms. So there are many individuals who are older that may have had mild symptoms, and it was just at a time when we had less knowledge and less an awareness of the symptoms and the criteria for it. So I think better diagnostics are the cause of that, rather than a increased incidence in it.
So in your professional opinion, you don't think any environmental factors are driving that surge?
Well, there could be. Certainly there's evaluation into that, and so there may be some environmental factors that can impact the risk for autism. However, the medical community hasn't found that there's any environmental factor that would increase that has caused an increase in it. The medical community generally feels that it's improved diagnostic criteria and improved awareness. So we're identifying individuals with milder symptoms more often and making the diagnosis more often, rather than finding an increased incidence of it, actually.
Understood. And as we're running out of time here, but I just want to get one more question in as we close this out. How should pregnant women interpret this new guidance? Should they avoid Tylenol altogether, use it sparingly, or just listen to their individual doctor?
I think most importantly, listen to their individual doctor. The American College of Obstetricians and Gynecologists has come out with a statement saying that they feel that acetaminophen use remains to be safe in pregnancy when it's used appropriately in pregnancy. Another thing for them to keep in mind is that maternal infections and maternal fevers are known and established to cause certain or pose the children to be at risk for certain neurological conditions. So not taking and not treating their infections or their fever actually could be harmful as well. So I think the last thing you said, really following the guidance of their individual physicians, is the most important.
All right, Dr. Adam Weinstein with Quinnipiac University, thank you so much for taking the time this morning. Greatly appreciate your expertise.
Thanks for having me.